Good evening, friends. This is Dr. Chetna Jain, gynecologist at Dr. Chetna's clinic in Palam, Bihar, and at Cloud9 Hospital, Sector 14. It's been a very devastating day for me. I lost two close friends today and three relatives last week, all to COVID. The last death, which happened today evening, the woman was just 40. So what we are seeing is unprecedented death. In the previous COVID wave, which was last year, we did not lose any relative. We saw the deaths in the newspaper, on the television, but we did not experience it in person. But now it is very real. It is staring in our face. We don't know whether we have another day to go or no. In this slide, I request each one of you to not step out of the house unless you really need to. That means, unless it is an emergency, please stay back, do whatever you can, because nothing is more precious than your life and the life of your loved ones. So, today we are going to talk on how to look after yourself during pregnancy, during the COVID times. I understand that all of you understand about masking, about social distancing, regular hand washing. So that is right, but how does it work in context to pregnancy? So first of all, we start with a positive pregnancy test. So once you test positive, the earlier you used to rush to the hospital to meet the doctor and to know what are the do's and don'ts and what needs to be done and what is the next step. But now you can avail a teleconsult, and if you're positive, just contact your doctor, fix an appointment, keep all your previous investigations ready. You can WhatsApp the doctor or you can upload on the app the reports that you have got, take an appointment, and meet the doctor virtually on the net and discuss your problems. For that, you need to take a paper and pen and note down the problems that you've had, and so that you don't miss out. Just like your shopping list, when you go out shopping, you have to have your list so that you don't miss. Similarly, when you talk to your doctor, you should have your list ready so that you don't miss. Then your paper pen has to be ready because the doctor might speak something and you would like to record that, to write down the salient important points which you don't want to forget and use them. And certainly at the end of consultation, the doctor is going to make your prescription and send you on WhatsApp. You can print out this prescription and use it to buy medicines or to do an ultrasound, because as you understand that without a properly stamped doctor's signature and registration number, you can't do your ultrasounds. Remember, whenever you're going for ultrasound, you must carry your Aadhaar card. We try to minimize the scans as much as possible, but for a bare minimum, we need 4 to 5 scans in the pregnancy. The first scan is to confirm the heartbeat and identify what is the delivery date. So here I come that, you can certainly take the first prescription online, buy your medicines online, or ask a chemist to deliver you home. But then for the ultrasound, you will need to step out because law of the land doesn't permit ultrasound at home, unlike the Western countries where ultrasound can be requested at home. So in this scenario, you need to go step out. So when you step out, what are the precautions? Do not wear very loose clothes. You try to wear some clothes which are well fitted so that you don't touch it here and there. Certainly, you must carry your things in one bag and try not to touch the railing, not to touch the lift buttons too much, and try to stay away from people. If you think there is a lot of rush there, you try to be away. If do not go to the hospital with many relatives. Ideally your husband or your family should wait outside in the car and you just walk in. This will reduce the number of people inside and thereby the chances of contracting COVID. But what happens is each one of you feels, okay, it's only my husband, and then the other person also feels the same. And that ways, if there are only 50 people coming to the hospital, it becomes 100 to 150, and that increases the virus load in the surroundings. So, my humble request is try to see your doctor independently. And in case you want your husband to participate, we can always take him on video call or a phone call and discuss. This is only temporary, my dear. This phase will pass, and again, we'll be back holding hands and hugging each other. But please bear with us for this time being. Now, this next step would be when you go for ultrasound, you try to take the first appointment. And if you think your appointment is getting delayed, you did not get your first appointment, you leave your number with the receptionist at the ultrasound center and tell them that you're waiting outside in the car or in an open area till your turn comes, and then you can walk in, get your ultrasound done. During ultrasound, do not remove your mask, do not breathe heavily, and the doctor certainly is taking full precautions, and they are sanitizing, changing the bed, doing everything whatever they can. We are using air purifiers, we are doing a lot of things to control the spread of virus, but in spite of that, you will have to use your own sense. So, what is most important is a well fitting double mask or an N95. Now, a lot of you, as soon as you enter the chamber, you think this is a safe area and you remove the mask. This is not the case, because in the same chamber, at least 25 to 40 other people also enter. So so many people have come in and gone out. So the virus load could be very, very high. So please, my request is, do not believe that the doctor's chamber is free, and you know, you can stay maskless only at home, provided all the family members are COVID negative, but certainly you cannot afford to remove your mask in the public. I see a lot of people drinking tea, drinking water. If you can hold on, please hold on. If you can't, you carry this water in an open area and drink and come back. Please, please do not try to your mask. This variant is affecting people of all ages, unlike the previous variant, which is affecting only the older age. Now, the younger people are dying, and the mortality is very swift. At one point, you realize the oxygen saturation is 90, and in a few hours, the person is completely gone. So, it is important for you to be absolutely sure that you are not exposed to virus. Now, suppose accidentally you are exposed to virus because some of your family member contracted it or somehow you contracted the disease. In this light, you do not panic. Pray and say to yourself that I will come out of it. What is most important is you must do a prone breathing. Now, what is proning? Proning is that you lie down on your tummy. Now, this would be difficult for women in the second and third trimester. All those in their first trimester are able to do. So, for pregnant women, the position recommended is semi-prone, that you either you can take a knee chest position just the way you put your head down in Gurdwara or temple or in mosque when you separate your legs and bend your head. So either you can do it this way, but if you are in little advanced pregnancy, you can bend your knees, keep the knees a little wide apart, put 2 or 3 pillows on the bed, and then try to put your head on the pillows and deep breathe. Now, this has to be continued for a couple of minutes. It's not just 1 or 2 breaths and you can come up. And this, if you do it regularly, what is recommended is at least 1 to 2 hours every 6 hours. If you can do that much, this will bring up your oxygen level to 6 to 8%. So it is important all the time to maintain your oxygen above 94. And if it is less than that, you need to report to the treating doctor anytime. If the oxygen levels falls further, then probably you might need hospitalization. The other thing which all COVID people who are having COVID positive, irrespective of pregnancy, they need to know that, you know, if your disease, if your fever, if your cough, your virus, your oxygen saturation, it all becomes fine in 5 days and you have no fever or nothing on day 6, then most likely you will come out of it. But if on day 6 you think there is fever, then this is knocking that the virus has entered badly into the lungs. And this is the time when you should consult the physician immediately, and you will be put on certain medications to control the disease, to prevent the cytokine storm, and to prevent the damage to the lungs. So it is extremely important to monitor. As soon as you start running fever, it is important to count your days. Now, the biggest mistake people do is they forget to count, and then they have no clue which day they got fever. If you get fever, you start charting it, write the date, time, and the temperature, the oxygen saturation, the pulse. If you are a diabetic, you start monitoring your sugars. All of you pregnant women, please start taking zinc and vitamin C. This is protective. And try to wear double mask, wash your hands, wash your face, change your clothes, and try to be away from people. If you are sitting in common area, try to sit away from people. I still see a lot of people talking to each other. Please do not talk much. I'll, please do not breathe very heavily. Breathe lightly. Do not talk much. Do not open your mouth. Try not to eat or drink in the common area. And try to finish your appointment as soon as possible. If the doctor is taking time, which happens most of the times, please stay away. Stay in your car. Leave your number with the coordinator. The coordinator will call you at the time. You can step in. Do not believe that if you hang around the door of the doctor, you will be seen first. It will all be by numbers only. So please do not make a lot of rush indoors in the hospital, and try to be outside. So these are all the precautions that you should take to prevent COVID, to prevent the spread of COVID, to keep yourself and your family safe, because when it happens, most of the people will recover, but 15% will need hospitalization and 3 to 5% will lose their life. And we can't afford to lose anyone. Please, 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 once again, my request to follow these instructions and you will be safe and secure. Thank you. Stay safe, stay healthy, and stay away from people. Thank you so much.